This conference will now be recorded.
Hey class, we're finishing up our section in the physiology area of the nervous system. We're going to talk about learning, memory, pain, and a little bit about aging. You're going to find the information from the topics we're discussing today in your textbook, Applied Anatomy and Physiology for the Manual Therapist, page 200 to 205. So the nervous system has a bunch of components that is integrated to function as a whole. Okay, so he talks about the afferent or sensory neurons that monitor the internal and external environments, picking up stimulus, right, through the receptors. We have the spinal cord and brain, are components of the central nervous system that receive and organize data, formulating a response, which we call integration. And then we have efferent neurons, which deliver motor commands to the body's effectors. We learned about the somatic divisions and the autonomic divisions. And so we completed the entire story about the nervous system. However, there are a lot of things that are largely unexplained still to this day in neurophys. So I cannot teach you this because it is largely unknown at this point. But it fascinates me because we live in a time where there's so much information and so much more understanding, and the nervous system in medicine is an anomaly because there's so many things, so many symptoms and conditions that happen in the nervous system that can't be treated very well because it's not understood completely, okay? We don't understand how the brain translates energy and pulses into thoughts or ideas and emotions. It happens, but we don't know how. We don't understand why some stimuli are interpreted as pain and others as pleasure, or how these things get mixed up. We don't understand how perception, so perception is the awareness of something happening and putting stock into it. It requires conscious awareness, right? Because we have sensory stimuli happening around us at all times, and our brains on spinal cord are receiving messages about our environment ongoing. But if they are repetitive, it becomes subconscious and we're not really aware of it, right? We don't really understand why that happens. We also don't understand how does the body function without our awareness of all these things going on. You know, there's in naturopathic medicine, we call this the this unknown, unseen force of nature that is unstoppable, that just wants to repair and heal and function. And there are things in the environment, emotionally, physically, mentally, that are blocking this from occurring. So it's largely unknown. So learning and memory. Memory is the ability to recall a previous sensation, skill, knowledge, or event. We've all been through learning and memory. I mean, of course you have, because you are in the second part of your course in massage therapy. So learning and memory are vital to you right now. But memory and learning really do undergo the same physiological process and happens as we see like children growing. New synaptic connections are made between neurons. This is memory and learning. We are more or less born with all the neurons we're ever going to get, although that has been challenged recently by realizing that the hippocampus of the brain actually produces quite a bunch of new neurons. But it's the new synaptic connections that really make learning and memory happen. And that active repetition actually strengthens those neural connections and becomes a network. And then finally, if that pathway is utilized repeatedly, then it becomes a subconscious because it's a subconscious learned thing that you don't have to put much conscious attention to. It's kind of like a beaten path, right? The first time you take a path, it's a little bit rough going. You can't really remember the way the second time, but the more times you take that path, the more subconscious it is. Think about when you drive. Well, maybe you're not doing that right now, but driving to work or driving to school or driving to a place you visit often, when you arrive there, you might actually realize that you don't remember how you got there because it was all subconscious, even though you were operating a motor vehicle and probably should be very aware. Your memory, your central nervous system has developed, and peripheral nervous system for that matter, has developed these connections that make it all possible without you even having to think about it. So pain is defined as an unpleasant sensation or emotional experience associated with actual or potential tissue damage. Okay, that's the kind of the definition of pain, although there's some things that are a little bit interesting about it. Pain is important to our survival as it serves as an alarm that something's not quite right. It's protecting us from damage, okay? It's guarding our injured body so that it can heal. And it's also a learning opportunity so that, well, in children as well, maybe as adults, we learn not to do that again, right? As long as we're aware of what we're doing and we're consciously perceiving it. And then we can modify our behavior to avoid that outcome in the future. So theories of pain. The gate control theory is what we got to go on. Melzack and Casey conceptual model in the 60s showed that pain is a result of interactions within the nervous system. Okay, we have the sensory part, which is just the sensation of pain. We have the cognitive part and thinking and interpreting this pain. And then there's an affective component, which has a connection to the emotions or the feelings. Their theory was proven wrong in some ways. The structural and physiological specifics that were used in their model in the 60s was not valid, but the overall concept is still used today. So there's 3 stages with the gate control theory of pain. First is the signal. Sorry if this is getting cut off on your screen, but you have the slide. First is the signal, so the stimulation of nociceptors. Remember, nociceptors are detecting pain, right? So nociceptor sensitive tissue damage. This is picking up thermal, mechanical, or chemical injury. Then there's a message to the spinal cord. At the spinal cord level, we have reflexes. The withdrawal reflex was the response, the automatic response to a painful stimulus is to pull your hand or your foot or your limb away, okay? And that's usually using the reflex arc. It's handled at the spinal cord level. However, in the brain, there's still signals received and transmitted up to these higher brain stem and even the cranium or cerebral cortex involvement, okay? So that wasn't me, my daughter's with me. For on camera.
That's a blog.
Oh, it's hilarious. I don't know if you've heard it. Yeah, it's the blog.
Hi, blog.
Say hi.
Hi.
It's COVID times. We've got to do what we got to do, right? Okay, so in the brainstem in the brain, the RAS, which is responsible for our attention and awareness, and the hypothalamus create a autonomic nervous response. The messages are relayed to the thalamus, and if you recall, the thalamus are some nuclei that take in all of the sensory information that's traveling to the brain and sorts it or filters it. It prioritizes signals from each other, okay? So if something is continuous and happening in low grade, it's not as important to tell the higher levels of the brain what's going on. But when there's a pain signal, it gets prioritized, okay? These signals are also dispatched to other portions of the brain, the limbic system, which is our emotional brain, And then also the cerebral cortex, where there is the postcentral gyrus, which is responsible for receiving sensory input and making a decision about what outcome should happen from that. There's also a perception stage, which we have talked about somewhat, which is the, well, really the awareness, past learned experiences and memories, as well as an emotional connection to the sensory input that's coming in. Okay, so it links all of these things together, and you might have, you know, a feeling on the bottom of your foot, and oh, it feels sharp. Oh, I've stepped on this before. Oh, I remember my daughter was playing with Lego, right? Like you'll put those things together in like a millisecond, and the emotional response could be, ouch, my foot hurts. That makes me feel really sad. Or it could be, I'm pissed off because I told her to pick those up 5 times today, right? Like there's an emotional response attached to that. And you can even see that with kids. They fall down, hurt themselves, right? Like, I'm not super hurt, but they're hurt. They got a bump on the butt. And it takes them a second to kind of think about it, right? And if you, as the parent or caregiver, respond, oh my goodness, are you okay? Are you hurt? You can see the emotion kind of rising up in them that, oh my gosh, I'm so offended. You know, they're so hurt, even though they're physically not hurt. The pain is perceived in a different way, and they're learning that. So I linked a YouTube video there to kind of explain a little bit more about the gate control theory. You can definitely check that out. I don't test anything on the YouTube videos. It's just to help your understanding. A couple of things I want to talk about with the physiology of the nerves is the speed of propagation. So when you're talking about nerve impulse conduction along the axon, there are a couple of factors that affect how quickly a signal will be transmitted. So if there's myelin, that is important. Myelinated axons are faster than unmyelinated. The axon diameter is also important because larger diameter axons also propagate faster. And temperature, heat propagates faster than cold. So applying heat or applying cold, or the body temperature of the individual. The propagation speed of a nerve impulse is not related to a stimulus strength. Okay, it doesn't matter how strong the pain sensation is. It really matters about the structure of the axon. So larger myelinated fibers conduct impulses faster due to size and saltatory conduction. Touch nerves, or nerves that are picking up, sensory nerves that are picking up touch, light touch, vibration, are larger than nerves that transmit pain. Okay. There's also different fiber types. This might come up in other courses for you. I think, and then some of the videos also describe these fibers, so I thought I would include it here. A fibers are the largest. They're myelinated fibers that are involved in the somatic, sensory, and motor division to the skeletal muscles. B fibers are medium sized. They're myelinated as well, and they are for the visceral, sensory, and autonomic preganglionic pieces. And the C fibers are the smallest. They're unmyelinated, and they are for sensory and the autonomic motor. So the gate control theory of pain asserts that non-painful input closes the nerve gates to painful input, which prevents pain sensation from traveling to the central nervous system. So the thought is, well, for example, when you rub the injury, it helps to resolve the pain. Why? And also this first video gives you an example where you actually bite your lip. It's kind of fun, follow along, and you'll see for yourself how this theory actually it works. So the thought is that touch receptors or touch signals, okay, over top of a painful signal will travel to the central nervous system more quickly, and thus preventing the pain signals from getting in and being inputted into the central nervous system to be perceived. Although the pain is still happening, okay? The damage or whatever is still happening. But the unfortunate part about pain receptors and what's the word I'm looking for? The adaptation of those nerves isn't there with nociceptors, okay? So if you, like with thermal, for example, with thermal receptors, you can actually get accustomed or adapt to the sensation. But with nociceptors, there's no adaptation, so the pain never goes away, never is perceived or diminished. So the gate control theory of pain is very helpful for managing pain, and can be a very good tool to help somebody who's dealing with chronic pain. The second link video is a little bit more complex in explanation. Keep your shirt on, okay? Yeah, keep it on for now. And I'm not going to test you on anything in this second video, but please, okay. But please watch it because I think it's quite interesting and will be very helpful to you in your career. So some techniques that can be used to control pain using the gate theory mechanism is using things like touch or vibration or counter irritants even to block the pain. Counter irritants include menthol, capsicum, camphor. These are found in many topical pain remedy solutions, including massage oils, essential oils, like tiger balms, those kinds of things, icy hots, and can be quite useful. Actually, capsicum has been proven to block substance P, which you'll learn about in this video on how that actually transmits the pain signals. This theory also helps to explain how placebos, emotional excitement can modulate the pain experience. I noticed this in my daughter. She has really long hair, as you may have noticed. It gets very tangly, but we want to keep it long, or she does mostly, and she does pretty good at letting me take care of her hair so that we can keep it long. But I noticed that if I give her a toy or give her something to play with while I'm brushing her hair, she does not complain about the pain of the hair brushing. But if she's just focused on the hair brushing, oh my gosh, it's a nightmare. I'm like, I'm not hardly pulling. How is this painful? But when she's enjoying her favorite video or her favorite toy, it's a much different experience for her. So you can manage the pain by engaging in emotional and cognitive dimensions. So like laughing or, surrounding yourself by things that make you feel happier. That's why depression and stress actually accentuates pain sensation. Complementary and alternative medicine knows this already, and many disciplines focus on the connection of mind, body, and spirit when addressing physical ailments, physical manifestations. Pain is an experience that is individual and unique by the person. It can be shaped by many things, including the age, gender, personality, culture, pain memories, fatigue, stress levels, mood, like I mentioned. The pain threshold is the amount of stimulus required to produce a pain signal, okay? Where pain tolerance is the amount of pain a person can withstand. Pain is a poor indicator of a severity of injury. You can't go off of somebody's perception of pain because of the pain threshold and pain tolerance issue. So the severity of injury rates the degree of tissue damage, okay? The severity of injury rates the degree of tissue damage, not the degree of pain. Although pain is individual and is perceived by an individual, you need to trust your client's report of pain or discomfort in your treatment with them and make the essential adjustments, okay? Two types of pain. These broad categories are based on underlying cause, okay? The somatogenic pain is arising from the body, where the psychogenic pain is arising from the mind. Nociceptive pain is coming from stimulation from certain kinds of temperatures that are out of the range of what is comfortable. Mechanical irritation, chemical irritation is going to trigger those nociceptors. This includes superficial, deep somatic, and visceral pain. Referred pain is coming from the viscera injury, okay? This is coming from an organ that is affected, and the pain is showing up in another body area that's separate from the organ. Psychogenic pain, the one from the mind, has physical pain. It can manifest as physical pain, just like neck pain, right? I have such a pain in the neck when you're stressed, right? Nothing might have actually happened, or we don't know what's happening, probably muscle tension, pulling, you know, but right, like no injury actually happened. Or a kid having a stomach ache before they go for the first day of school, right? There's an emotional pain there that is manifesting in the mind or in the body. So there's emotional, mental, and behavioral factors that affect psychogenic pain. The pain is real, okay? I want you to understand that. Because it's arising from the mind does not mean that it is a fake or anything like that. It's real pain, and it needs to be treated and managed at that same level of respect and attention that any other pain would, okay? And a lot of times, like psychogenic pain, could actually be just a difficult to find the cause, and Western medicine tends to not regard it as a cause. It's not really there, often treated with antidepressants and things like that. But in like Eastern medicine or alternative complementary medicines, the emotional pain is very much regarded in their assessment and treatment. So I just wanted to break down a couple of types of pain so that you can understand what we're kind of dealing with, because as a clinician, you're trying to get to the root cause of an individual's pain, and knowing a few things to navigate in the treatment room or the evaluation can help you better distinguish what is the cause of their pain, so that if you know the cause of their pain, you're more likely to treat it effectively. So a superficial pain is going to feel sharp and localized. Okay, this is because the nociceptors in the skin and the superficial fascia are disrupted. Okay, they are signaled. This can come from bruising, lacerations, abrasions, superficial burns. Okay, that's a superficial type of pain. Deep somatic pain or deep body pain is going to be dull, achy, and diffuse. Okay?
Yes.
Want my help?
Yeah.
Got it? So deep somatic pain is dull, achy, and diffuse. This is triggered by nociceptors in ligaments, tendons, muscles, fascia, bones, or blood vessels. Very deep, right? This can be caused by strains and sprains, fractures, myofascial dysfunctions. Visceral pain, this is organ pain coming from the organ, whether that's an injury or dysfunction. This is going to feel like achiness, cramping. It can be localized, okay, but it can also be referred. Here's a table that has some good definitions of pain terminology, and I do expect you to know them all, okay? You know, I didn't put here, I'm gonna add it. You'll have it in your notes because I will have edited this before you get your notes. But there's also neuralgia or nerve pain. This is going to feel like sharp or like burning or shooting pain. And the source is the nerves, okay? And the cause is some sort of nerve damage. I've included a PDF of this pain terminology so you can print it or save it and refer back to it as much as you would like to. So just a little comment on referred pain. This is a referred pain map. It's a very typical of where pain is going to show up if it's referred pain, which is linked to an underlying organ. Okay, because organs don't have a ton of sensory receptors for pain, eventually it'll irritate the spinal nerve that it is related to and might show up on the dermatome, which is linked. Okay. Okay. Keep it down, okay. So like with the heart, if someone's having a heart attack, it's very typical that they're going to have a referred pain pattern on the left chest wall or pec, down the arm, and maybe even the neck, okay, or jaw. Where like gallbladder pain is going to refer to the right shoulder, more or less. This is kind of a different one than I've ever learned, but small intestines usually around the umbilicus. The kidney pain can be local. It can be localized and right at the back, okay? But it can also be presenting on the flanks, so the sides of the hips, or even like the side of the torso. And it's important for a manual therapist because people are coming to you for pain a lot, and having an awareness that there might be a pathology related to an underlying organ, just to have that awareness, right? When you do your workup and you're like, I'm not seeing any of the typical neurological signs or things that would go with this pain they're feeling. You want to consider on your differential list the possibility. Turn it down. Turn it down, please. You want to have the awareness that there might be some other problem going on, and that needs to be referred to their medical professional. Pain management, right? Huge industry. Drug therapy, widely used. This includes over-the-counter, just things that you buy at the store, or prescription medications. We have an opiate crisis, right? Pain. And that's, if you look into the opioid crisis, it actually highlights the connection between physical pain and emotional pain. North America is plagued by emotional pain that's not resolved, and it's not addressed properly. And I think the mental health aspect needs some attention, in my opinion, in our healthcare system. I don't think it's addressing our day-to-day life living situation. Instead, it's addressing severe mental illness, which is great. We do need that, but I think there's a lot more people suffering, and they're self-medicating. Other prescription medications that can be used are muscle relaxants, right? Take the muscle strain or the muscle tension out. Sleep aids, it's hard to sleep when you're in pain. Antidepressants, like I mentioned, having and it's not necessarily meaning that it's all in your head and it's not real, which a lot of people, I think a lot of my patients interpret that when they're given antidepressant medication for fibromyalgia, for example. But it does show to be effective on pain, and if it's affecting the serotonin levels, which are neurotransmitters, which is affecting the nervous system, it's not necessarily just saying it's all in your head and you're depressed or you have anxiety, but these things are enhanced. Pain perception is enhanced with mood dysregulation. Other effective methods could be surgery, right? You want to get to the underlying cause. There might be something that's compressing a nerve or causing irritation or inflammation in the body. Acupuncture, which is what I love. Hydrotherapy is what you learn a lot about as well in this pathology course actually. Biofeedback can be useful, hypnosis, art or music therapy, meditation, visualization, I think are huge, prayer, deep breathing, and of course, laughter. You know, you're releasing your own endorphins, which can resolve pain and help pain management. So for assessing pain, you want to do two things. You want to do a very thorough health history and interview. I think the greatest gift that I've learned through some of the amazing doctors that have trained me was telling me that it's so important. You will get further with somebody if you listen. You listen with curiosity and you collect as much information from them as possible. Patients and clients will understand their bodies. They will give you the information to the best of their ability. And you as a clinician, you want to get specific information out of them because it can help you differentiate what might be causing their pain. And if you can get to the bottom of it, you will have more success treating their pain. So you're looking for, I call it the low Dr. Ficara. I may have mentioned this last year to you all, but just to review it, the low Dr. Ficara is the LODRFICARA. To remember all the things you need to ask, okay? So location, onset, duration of pain, so like how long does it last? The radiation of pain, does it travel anywhere? You know, if the pain's in the back, does it go down the back of the legs? How frequent does the pain occur? Is it happening every day? Is it happening every month? How intense is the pain? On a scale from 1 to 10, how much cramping or how much shooting pain do you have? The character of pain, which is it dull or sharp, shooting? Associated symptoms. So for example, if it's more of a visceral pain, sometimes there'll be more autonomic symptoms associated with it, like sweating or nausea. What are the relieving factors? What are the aggravating factors? Is it better with rest? Is it better with activity? Is it worse with activity? Is it better sitting or standing or bending or with hot or cold, right? Those are all things and clues that are going to help you bring you closer to what it could be. The physical assessment is the measurable and objective signs that you as the clinician will elicit in your treatment. You can observe swelling, redness, or heat. You'll test for range of motion and see if there's any losses. Is there any numbness or altered sensation, weakness of the muscles, balance or coordination issues? Are they having memory issues, or is there a level of alertness kind of off? These are things that are very specific to the nervous system and can point to actually some disharmony and disease. Types of pain can be acute or chronic. Acute is a sudden onset, 6 months or less. It's generally nociceptive, so this is going to be related to pain. Acute pain is usually related to some kind of trauma or infection that's resulting in an inflammation. This is the diseases or conditions that have the itis, right? That indicates inflammation. Chronic pain is lasting more than 6 months. This pain is lasting longer than an expected healing period or injury. This can be somatogenic or psychogenic, so arising from the body or the mind. So you also have systemic conditions or structural conditions. Sorry, I have a tickle in my throat. So systemic conditions affect the entire body and will have an underlying condition that's relating to widespread inflammation or damage, okay? This could be something that's more of an autoimmune disease or affecting many different structures at the same time. Fibromyalgia, IBS, chronic fatigue syndrome, rheumatoid arthritis are all examples of a systemic pain condition. Structural conditions are local problems. So a specific structure is affected and in a stage of healing. Examples of this are plantar fasciitis, strains or sprains. With pain management, manual therapy is a proven and effective treatment. Okay, it's awesome. It's been evaluated and studied, very much so. Different techniques at different stages of pain experience. Okay, so depending on what's going on with that person. If they're in an acute stage, lymphatic drainage may help decrease the nociceptive stimulation. This is helping by removing chemicals that are released by the damaged cells to stimulate the healing process. Gate control, massage can override the message stage of the pain, right? By flooding the spinal cord and lower brainstem with sensory inputs so that that pain message can't get through. And then the perception. As a therapist in your treatment room, and just by your relationship, right, your therapeutic relationship with your client, you're creating a healing environment and experience. This helps clients reconnect mind, body, and spirit. I know, like, as a patient, I've gone to see a massage therapist or another alternative health practitioner, and it just feels good to just have somebody listen, right? Just to listen to what's going on, where, you know, I have mad respect for medical doctors. They just don't have the time to let you talk, right, and listen. They have a lot of people to see, and I can imagine with all the people they're required to see in a day, how burnt out that they could get just by listening to all the people they have to see in a day on a continuous basis. So, but I do think that that's a really important part of a therapeutic relationship and setting the stage for healing. So with aging, natural decline in the decay of myelin sheaths, so slowing down impulse conduction. Synaptic connections will diminish and brain mass will diminish. And this is largely because if you don't use it, you lose it, right? You need repetition and practice to maintain neuronal connections and pathways. But if you don't use it, then those things can disintegrate, right? There's going to be gradual declines in thought processes, memory, balance, and coordinated movement. And the rate of changes are influenced by lifestyle choices. So it's not like everybody's doomed to lose their brains and their minds, their memories, and their body functions. It depends on what we do throughout our life that really sets the stage for how we will age. So with nervous system prevention, you're really looking at regular aerobic exercise, okay? Aerobic exercise helps with the blood flow. So if you look on the right side of your screen right now, I included the Bright Minds risk factors. I'm a huge supporter of Dr. Amen from, he's from the States somewhere, but he's a psychiatrist that helps people with brain and mind issues.
You turn it down, Ale. You turn it down?
And so the Bright Minds stands for different elements or risk factors for the nervous system. So you can check him out. I'm not going to test you on that, but it's Dr. Amen. Look at Bright Minds. So cool. But just to keep it simple, let's go with regular aerobic exercise. Aerobic exercise stimulates blood flow. It stimulates the health of your vascular structures so that getting adequate blood flow to the brain is hugely important for how it works. Getting adequate sleep is a big deal. You need to give yourself that yin time or that parasympathetic time to actually rejuvenate and recuperate. Good nutrition, your brain needs a lot of blood flow, a lot of oxygen, and a lot of repair, specifically those ions or electrolytes to maintain function. And also engaging in enjoyable and mentally challenging activities will help to keep those synapses strong and keeping those neuronal connections and networks in place and maintaining them. So if you don't use it, you lose it. So that's the end of our lecture. That's the end of our nervous system unit. I hope you really enjoyed this most difficult and challenging system of the body that is hugely important as it controls everything. So thank you so much for your attention, and we'll see you next time. Bye now.